Michael Tildesley is an Associate Professor of Life Sciences at the University of Warwick in the UK. He joins me now. Thanks so much indeed for being on the programme with us, Michael. So we've heard the WHO say today that this is a different kind of virus. Do you think Europe is at risk of a second wave, or is it, as they suggest, more like one big wave?
Well, it's really a matter of semantics, really, whether we define it as the same wave or a second wave. The issue is one of the consequences of going into large-scale lockdown means that, of course, you go in because you're trying to protect the health services of your countries and reduce the number of deaths. And, of course, there are very valid reasons why we might do that. And, of course, there are signs that that was effective. The consequence of that is, of course, though, that as we come out of lockdown, then there is still an awfully large number of susceptible people who have not already been infected. So as we come out of lockdown, as the reproduction rate goes up, we might expect to see a rise in cases. So in a sense, we could be seeing a second wave, but really it's cases that we may have seen in a first wave had we not have gone into lockdown.
And in your opinion, do you think countries prioritised wealth over health by reducing restrictions too early?
I think this is a really, really difficult trade-off. I mean, the thing is, if you talk to an infectious disease expert, such as myself or some of my colleagues, we would always say, if your only consideration is minimising the direct impact of public health of the COVID pandemic, then of course everyone stays in lockdown until we have a vaccine available. The problem is, of course, when the politicians are making decisions, they have to trade that off against the economic aspects, and it's a really, really difficult calculation. As we're easing out of lockdown, the crucial thing now is if we do start to see a rise in cases, as we've seen in Spain, and there is evidence that that might be the case in France and Germany and some other countries, that we react rapidly, because what we want to do is avoid a large second wave, avoid health services being overwhelmed. And that's why it's really important that responses are put in place rapidly to try to prevent the risk of that occurring.
And do people need to just fundamentally change the way they behave to stop the spread of the virus? And will preventing cross-border travel help?
I mean, to some extent, preventing cross-border travel helps if cases within your own country have reached low levels. The reason that maybe international travel wasn't a major risk a couple of months ago was because we were dealing with epidemics in many countries throughout the world that were very active. There was an awful lot of community transmission going on. And when that's the case, really, actually, the risk of transmitting across borders is pretty low. When you start to get to very low numbers of cases, that's when international travel becomes more of a concern. So in terms of whether people need to change their behaviours, unfortunately, we're in this for probably many months to come, that we may start to see rising cases, possibly reactions in terms of local or larger scale lockdowns, possibly further relaxations. We may see a cycle of this, unfortunately, possibly until in the longer term a vaccine is available.
OK, good to speak to you. Michael Tilsley from the University of Warwick.